Experts are warning the lifting of mandatory COVID-19 isolation requirements in less than 2 weeks is not the end of the pandemic. Victoria's Australian Medical Association President Dr. Roderick McRae said the federal government's decision to lift the isolation requirements will result in an increased risk of illness and death from the virus. However, he said it is not yet clear how much the risk will rise. Explained, Australia to end mandatory COVID-19 isolation periods on October 14. McRae added the lifting of restrictions will inevitably see a rise in infections. However, many Australians have already been cheating around the margins by not reporting or isolating when they are infected. He said the lifting of restrictions was an extension of what Australians were already doing. What we have seen is a mixture of politics and public health trying to find a pragmatic outcome, he said. We need to work sensibly. McRae said the lifting of mandatory restrictions is not the end of the pandemic. This is not bye-bye to COVID-19. It is a very unhelpful sort of statement. This is lifting mandatory requirements, he said. We want all respiratory illnesses to be treated the same so that if anybody has any symptoms, they stay home. Read more. Man injured during alleged drive-by shooting on Gold Coast. The chief medical officer has already warned restrictions could be re-implemented if another dangerous variant evolves, but McRae said they should also be reinstated if there is a high uptick in severe illness and strain on hospitals. Prime Minister Anthony Albanese announced yesterday following a meeting of National Cabinet the mandatory restrictions would be lifted from October 14. The move comes as a relief for business owners that have been struggling with staff shortages. It is also expected to free up some money in government budgets because it will no longer be funding pandemic leave payments for casual workers.